Welcome to my channel, Body Talk.
Sexual dysfunction, any issue that keeps an individual or couple from finding fulfillment in sexual engagement, can be classified as sexual dysfunction. 31% of men and 43% of women report having some form of sexual dysfunction. Overview: it is sexual dysfunction. Anything that keeps you from enjoying sexual activity is considered sexual dysfunction. Sexual dysfunction may manifest as the inability or unwillingness to enjoy sexual activity. It is extremely curable and quite frequent. It can be brought on by stress, illnesses, drugs, or previous sexual trauma. Any stage of the sexual response cycle might result in sexual dysfunction. A person's reaction to sexual stimulation can be modeled in 4 stages. Using the sexual response cycle, it consists of desiring sex and getting aroused are aspects of the excitement phase. It encompasses a large portion of the sexual activity that occurs before the sexual contact, such as foreplay, clitoris enlargement, or penis growing erect. Resolution: the quiet time immediately following an orgasm. Your genitalia return to their typical state when your body relaxes. Many people dislike discussing sexual dysfunction despite data suggesting that it is widespread. However, you should discuss your concerns with your spouse or partners and your healthcare physician because there are therapy alternatives available. What kinds of sexual dysfunction are there? Sexual dysfunction is divided into 4 groups or sorts by medical professionals. Lack of interest in or desire for sex is a sign of a desire problem. This could indicate that you're not interested in having sex of any kind. The inability to become physically aroused or enthusiastic during sexual activity is known as an arousal disorder. Your body may not react when you feel the need for sex. If you have a penis, this may indicate that you are unable to achieve an erection. Disorders related to orgasm, absence or delay of climax. You might experience arousal and desire yet not be able to orgasm. Pain disorders: when you experience pain during sexual activity, you desire to avoid having sex. What is the prevalence of sexual dysfunction? Any age can be affected by sexual dysfunction, while those over 40 are more likely to have it. Between 30% and 40% of people will experience sexual dysfunction at some point in their lives. Symptoms and cause: what are the symptoms of sexual dysfunction? Males are more likely than females to experience some forms of sexual dysfunction. On the other hand, women are more likely than men to experience some forms of sexual dysfunction. Male erectile dysfunction is the inability to get or keep an erection, hard penis during sexual activity. Ejaculation that is either delayed or absent. An ejaculation in spite of adequate sexual excitement. Incapacity to regulate ejaculation timing, premature ejaculation. In females, anorgasmia, or the inability to experience an orgasm. Dryness of the vagina both before and during sexual activity. Vaginal atrophy may be the cause of this. Unable to sufficiently relax your vaginal muscles to facilitate sexual activity, vaginismus. Anybody can experience sexual dysfunction, such as low libido, or a lack of interest in or desire for sex. Unwillingness to arouse. Intercourse-related pain. Dyspareunia closing parenthesis. Certain medical conditions, therapies or drugs. Hormonal shifts, such as low testosterone or estrogen. Sexual dysfunction. Psychological cause of sexual dysfunction can also be influenced by your feelings and emotions. These might consist of anxiety or tension. Issues in a marriage or relationship. Depression. Negative perception of one's body. History of abuse or sexual trauma. Which drugs have the potential to induce sexual dysfunction? Sexual adverse effects are possible with both prescription and over-the-counter OTC drugs. Certain medications can impact your libido, while others may impact your capacity to arouse or experience an orgasm. Testing and diagnosis show is a sexual dysfunction diagnosis made. Most of the time, you are aware of something that is preventing you or your partner from enjoying a sexual connection. Typically, your doctor starts with a physical and a thorough history of symptoms to rule out any medical issues that might be causing the malfunction. They might prescribe diagnostic tests. Lab testing usually has a very small impact in sexual dysfunction diagnosis. Outlook: does sexual dysfunction disappear? The root source of the issue determines how well sexual dysfunction treatment works. After treatment, the majority of patients resume a healthy and enjoyable sexual life. Therefore, the prognosis is generally favorable.